healthcare is one of the most quickly growing industries in the United States. In fact, healthcare costs in general have been going up at a rate of about 6% a year, which has been significantly outpacing inflation at about 3 to 4%. So with health costs on the rise, with Americans being forced to provide their own benefits or turn to the government should they be in a very low income situation, it's no surprise that we have many Americans who go uninsured. In fact, in 2007, there were over 45 million Americans who were uninsured. That was about 15.9% of the overall United States population. Some of those, about 5 million of the 45, were due to pre-existing conditions that prevented them from obtaining coverage, whereas the other 40 million were just things like inability to afford the coverage, which is a significant problem because if individuals cannot afford some sort of health coverage, that burden then gets placed back on the government, which in turn gets placed on the individual taxpayers. So not only are taxpayers paying for their own individual health policies, but they're paying a portion of the health policies for other individuals as well. So that is a major growing concern, and it is one of the reasons why comprehensive health care plans for our entire country, for everyone, basically called social type health care plans, have been proposed and introduced by many politicians in an effort to provide this socialized health care. Proponents of it might be someone like Hillary Clinton is a major proponent of health care. They want to be like countries such as Canada, who have provided this health care to all their individuals. Now, one major downside to that might be that hospitals are already overcrowded, and now all of a sudden, if people are able to go out and obtain free medical coverage, how much more crowded do you think the hospitals would be? The answer is they'd probably be a lot more crowded, and it would take a lot longer for people to get the medical care that they need. So it is a major concern, not only that the costs are rising significantly, but that people are unable to obtain the coverage as well. In my opinion, there will be a significant amount of reform in the healthcare industry in the coming 10 years, especially with the new president, some new policies being considered. I think there's going to be some major changes to the overall healthcare industry, and there certainly does need to be some major changes to our healthcare industry as well, especially with the rise of the baby boomers becoming seniors, potentially needing more and more care. They're going to be sucking up a lot of health benefits and costing the system a lot of money. So it's going to be important to reconsider how our healthcare system in the United States is structured. So this has been John Pinelli, financial representative, talking to you today about facts about healthcare.